So we can start the remaining parts of the important points regarding the Sharangadhara Samhita. So we can see शरीर के भीतर स्रोतस असंख्य माने हैं. According to Sharangadhara, स्रोतस is asанkhya, like innumerable स्रोतस are there in our body. Okay. आग्नेयस्थ पित्ता को अग्नि रूप मानते हुए उसके प्रमाण तिल मात्र माना है. आग्नेयाशयस्थ पित्ता, like the pitta which is residing in the Agni Ashaya, that we can consider as Agni. So the pramana of Agni is tila matra. Okay, so the pramana of Agni in our body is tila matra according to Sharangadhara. Then in Vamana karma, वमन में यकृ स्थित पित्त का निर्हरण होता है. In vamana karma we know the end part of the vamana is pittanda, because in vamana karma first of all we will be removing the kapha dosha, and the next dosha which is coming out is pitta dosha. Okay, so kapha will be coming out and then pitta dosha, then the last one is vayu will be coming, but vayu we can't see clearly, so that's why the end product of the vamana karma is pittanda. So in this Sharangadhara he is telling that in vamana karma whatever the pitta which is coming as end substance, that is coming from the yakrit pradesha. Okay, so in the Vamana karma, yakrit sthita pitta, the pitta which is located in the yakrit pradesha, so that is coming out as a pittanda, he is telling. So pittanda means pitta is coming, the complete removal of the kapha dosha is happened. So now the pitta is removing from the body, so that is indicating proper Vamana karma is done, and the pitta which is coming, that is coming from the yakrit pradesha, that is according to Sharangadhara. Then बोधक कफा को रसन एवं तर्पक कफा को स्नेहन कफा से संबोधित करते हुए कफ 5 ही माने हैं. So we know that kapha dosha, it is of 5 types are there. Okay. According to Ashtanga Hridaya Sutrasthana, we have studied that there is 5 types of kapha dosha is there: avalambaga kapha, kledaga kapha, tarpaga kapha, bodhaga kapha and sleshaga kapha. So these are the 5 types of kapha according to Ashtanga Hridaya. The same thing only Sharangadhara is also mentioned, 5 types of kapha dosha is there, but instead of bodhaga kapha he has mentioned the term rasana kapha. Okay, instead of bodhaka kapha he has mentioned the term rasana, and instead of tarpaga kapha he has mentioned the term snehana kapha. So like that of 5 types of kapha dosha he has mentioned. Okay, so instead of bodhaga rasana, instead of tarpaga snehana kapha, then avalambaga and sleshaga kapha, then kledaga kapha. Okay, so according to Sharangadhara, 5 types of kapha dosha, that is avalambaga, kledaga, sleshaga kapha, and instead of tarpaga he has mentioned snehana kapha, instead of bodhaga kapha he has mentioned rasana kapha. So like that of 5 types of kapha dosha he has mentioned. Next he has mentioned about the definition of the snayu. Snayu means it is a combination of the it is a joining part of the mamsa, asti and sandhi. Okay, स्नायुओं को मांस अस्थि व संधियों का बंधक कहा है. So it is a joining portion of the mamsa, asti and sandhi, that is called as snayu. Okay, then next one he is telling about the sandhi. चेष्टावान एवं स्थिरः भेद से संधियों 2 प्रकार की मानी है, तथा शाखा हनु व कटी में चेष्टावान संधियों व अन्यत्र स्थिर संधियों मानी है. Which means sandhi joints are 2 types are there, चेष्टावान and sthira, which means movable joints and immovable joints. Okay, so movable joints are shaka, hanu and kati pradesha. So the joints present in the shaka, hanu and kati pradesha, these are all cheshtavan sandhi, which means movable joints, and the rest of the other sandhis are immovable joints. Okay, like the 2 classification he has mentioned. Okay, then next thing is समाना वायु से प्रेरित रस का रंजक पित्त द्वारा हृदय में रंजन होकर रक्त की उत्पत्ति होती है. By the action of the samana vayu, rasa will be combined with the ranjaka pitta in hridaya, and then make the rasa will get the red color, and through that way rakta will be obtaining. Okay, by the action of the samana vayu, rasa will be reaching in the hridaya, and in the hridaya the ranjaka pitta will get combined with the rasa dhatu, and then color, the blood color will be red color. Okay, the red color will be reaching in the rasa, and through that way rakta will be obtaining. Then another thing he has mentioned is Anjana Lepa Snana Abhyanga Pradimasha Evam Vamana in Ubakramom ka prayog Janma se hi kiya ja sakta hai, which means from by birth itself, from birth or from the infant. Okay, so from after the birth itself, the baby we can give Anjana Lepa Snana Abhyanga Pradimasha Vamana till death. Okay, so from birth onwards we can give these type of treatments. Anjana karma we can give lepana, snana, abhyanga, pradimarsha and vamana. In Ashtanga Hridaya we have studied pradimarsha, nasya and basti. These are the main two karmas we can give from the ajanma shastam. From birth onwards we can give these two therapies. But Sharangadhara is telling Anjana, lepana, snana, abhyanga, pradimarsha and vamana karma we can give from birth onwards. नेक्स्ट वन इस भस्म के जाटराग्नि विकारों में गणना करते हुए इसमें वात व पित्त का प्राधान्य माना है. भस्म का मीन्स इट इज ए डिसऑर्डर, इट इज ए अग्नि रिलेटेड डिसऑर्डर एंड द मेन दोष रेस्पॉन्सिबल फॉर द भस्म का रोग इज वात एंड पित्त दोष. देन ही हैज मेंशन सोम रोग. ओके, Somaroga means it is a gynecological disorder. So it means it is a condition where the continuous excessive discharge, white discharge you will be getting. Okay, continuous excessive white discharge will be coming from the yoni pradesha, that is called as this Somaroga. Like mutra, like urine, it will be continuous excessive watery discharge you will be getting through the yoni, that is called Somaroga. This we can correlate with the leukorrhea, like that condition we can correlate. Okay, so Somaroga he has mentioned as a part of the Somaroga he has given some treatment, which the treatment Kadali Phala और आम्ल की स्वरसा को शर्करा के साथ लेने का निर्देश किया है. So for the condition, those the ladies who are suffering with the Somaroga, they can give the medicine is Kadali Phala. Okay, Kadali Phala and Amlaki Swarasa. In that we can add some Sharkara. So this we can give for the Somaroga Chikitsa, like that he has mentioned in the Samhitha. Then he has mentioned उदर्द रोगा में गेरू, काली मिर्चा एवं मधु का आभ्यंतर प्रयोग बताया है. उदर्द रोगा, उदर्द means it is a skin disorder like Shida Pitta. Okay, Shida Pitta, Udarda, like that disorder is there, the same thing. So Shida Pitta is a Vada predominant urticarial rashes and Udarda is a Kapha Pradhana condition. Okay, both are same disorder. Shida Pitta is a Vada predominant condition and Udarda is a Kapha Pradhana condition. Okay, so for the Udarda Roga, he has given the medicine is Geiru, Kali, Mircha and Evam Madhu. Geiru is Gaveruga and Kali Mircha is black pepper. Okay, so these two mixed with the Madhu, this we have to take it internally. So this is a treatment he has mentioned for Udarda Roga. And for the Shlipada he has mentioned we have to take Shakhodaka. Okay, Shlipada में शाखोडक का प्रयोग बताया है. For the Shlipada condition, शाखोडक has to be given. Then he has mentioned about Trigandha. Trigandha is Ilaichi, Dalchini and Tejapatra. Ilaichi is Ela. Okay, Dalchini is cinnamon and Tejapatra. Okay, so these three togetherly called as Trigandha according to Sharangadhara. Then चूर्ण को गृदा या मधु में मिलाकर चाटना हो तो गृदा या मधु दुगना ले एवं द्रव के साथ लेना हो तो द्रव 4 गुना ले. Which means if you wanted to mix churna with grida and madhu, okay, for licking the churna you have to mix it with grida and madhu. So the double the quantity of grida and madhu you have to take the churna. Okay, if you wanted to mix the churna with the drava, okay, with the liquids, if you wanted to mix with the churna, then you have to take the 4 times of drava. Okay, mixing with the grida and madhu, 2 times of grida and madhu you have to take the churna. If you wanted to mix with the drava, you have to take the churna 4 times of that. Okay, so like that of one combination he has mentioned. Okay, then in churna avaleha गुटिका एवं कल्का के लिए वाद पित्त एवं कफज व्याधियों में अनुपान की मात्रा क्रमशः 3-2 व 1 पल बताई है. For Anupana, okay, for some the patient will be suffering with the Vadaja Pradhana disorder, Pittaja Pradhana, Kafaja Pradhana Vyadhi. If the patient is suffering, for that if you are mentioned some of the Gudika, Kalka, Churna Valeha, for that along with the medicine some Anupana will be there. Okay, Ushnodaga or maybe Madhu or Grida, like that we will be giving some Anupana. If it is a Vada Pradhana Vyadhi, the Anupana you should be taken 3 pala. Okay, 3 pala means 3. Okay, 3 pala should be taken. If it is a pitta pradhana vyadi, 2 pala. If it is a kapha pradhana vyadi, 1 pala. You have to take the anupana matra. Okay, then snehana sevana ki matra ek pala batayi hai. For snehapana, okay, for snehapana, if you wanted to take the matra is snehana sevana matra is 1 pala. Then asava arishta, for them also dosage is 1 pala. Okay, then he has next mentioned about the dhadu and upadadu. Dhadu, according to Sharangadhara, it is 7 in number. Upadadu is also 7 in number. Okay, so 7 dhadu and 7 upadadu he has mentioned. So 7 dhadu is Swarna, Tara, Ara, Tamra, Naga, Vanga, Tikshnaka. Upadadu is also 7 in number, that is Makshika, Tutta, Abhraga, Neelanjana, Manashila, Haratala, Rasaga. So these are the upadadu and dhadu according to Sharangadhara. Then he has mentioned Visha and Upavisha also. According to him, according to Sharangadhara, Visha is 9 in number, Upavisha is 7 in number. So the numbers are very important. So dhadu is 7. Upadadu is also 7, Visha is 9 and Upavisha is 7 in number. Then Snehapana ka kala kinjit Suryoday hone par bataya hai. So Snehapana kala, the timing for the Snehapana kala he has mentioned it should be done in the Suryodaya. We have seen Sharangadhara, he has mentioned Aushadha Sevana kala is 5 in number. So the first one is Suryodaya. In Suryodaya we used to be given the medicines Vamana Virejana, for Shodhanartha purpose, whatever the medicines are there, that should be given in the Suryodaya. The same thing he is telling, Snehapana matra should be taken in the Suryodaya. Then Anuvasana matra. Okay, for Anuvasana Vasti matra he has mentioned. So for Uttama Bala 6 pala, for Madhyama Bala 3 pala, for Hina Bala Dheda pala matra. Next one is बस्ती देते समय बस्ती पुडग को दबाने का काल 30 मात्रा बताया है. बस्ती पुडग को दबाने का काल, बस्ती पुडग दबाने means like while we inserting the basti netra. Okay, so we will be pressing the basti podaga and through that way medicine will be reaching into the anal region. So that pressing time is 30 matra he has mentioned. Basti podaga pressing time is 30 matra. So that much period you have to press the basti podaga. So through that time medicine will be reaching in the Guda Pradesha. Next one he is telling about the Uttara Basti matra. So Uttara Basti matra, if it is age below 25, okay, age below 25, the matra of Uttara Basti is 2 karsha, and above 25 year aged person is coming for Uttara Basti, so 1 pala is the dosage. 25 age below is 2 karsha, above 25 year is 1 pala. Okay, then Kapha Pitta evam Vadaja Rogom Hedu Nasya Kala Kramashaha Purvarna Madhyana va Aparana Bataya Gehe. For Nasya Kala, okay, for it is a Kapha Pradhana Vyadi, Nasya Kala is Purvana, that is in the early morning. If it is a Pitta Pradhana Vyadi, Madhyana. If it is a Kapha Pradhana Vyadi, Vada Pradhana Vyadi, we have to do it Aparana, that is during in the evening we have to give the Nasya Karma. Okay, so Nasya Kala according to the dosha, for Kapha it is Purvana, for Pitta it is Madhyana, for Vadaja Roga it is Aparana. Then usually Nasya Karma should be done in the daytime, should not be done in the night time. But in the emergency condition like Sannyasa, okay, if the patient is like unconscious condition, so that time you can give it in the night time. In emergency situation we can give Nasya Karma in the night time, otherwise always it is indicated during the daytime only. Then Pradimarsha ke 14 kaal bataye hai, which means for Pradimarsha timings he has mentioned, so 14 times, like 14 times, and in 14 1-4, okay, so 14 times kala he has times are mentioned for, in 14 times we can give this Pradimarsha Nasya, like after the food, before the food, or after brushing the teeth, like that of different times are there. So that like that 14 times he has mentioned for Pradimarsha Nasya. Then Nasya Dharana Kala 5, 7 या 10 मात्रा काला बताया है. Nasya Dharana Kala, we will be putting the Nasya and we should hold the medicine in the nose. Okay, so that is 5 matra, 7 matra, 10 matra he has mentioned. Okay, so 5 matra, 7 matra and 10 matra we have to hold the whatever the oil or it is a swarasa, we have to hold it, and then after that, after holding for this much time, then we have to the doshas will come in the throat region, so that we have to spit it out. So the spitting is, we have to do it in the right and left side, we have to spit it. Okay, first of all you have to spit it in the left side, then you have to spit it in the right side. So like that of whatever the doshas are coming, so each side you have to spit the kapha dosha. Okay, so nasya dharana kala is 5, 7 and 10 matra. Then Dhumapana he has mentioned, that is of 6 types are there: Shamana Dhumapana, Brahmana, Rejana, Kasakna, Vamagan, Vrana Dhupana. Okay, so this type of 6 Dhupanas he has mentioned. Dhumapana 6 types according to Sharangadhara: Shamana, Brahmana, Rejana, Kasakna, Vamagan, Vrana Dhupana. This Shamana Dhumapana again it is classified into 2 types, Madhyama and Prayogika. Brahmana is again classified into 2 types, Naihika and Mrudu. Then Rejana is classified into Shodana and Tikshna. Okay, like that he has classified two classification for the each Dhumapana. Then Gendusha and Kabaladharana is also mentioned. So according to him, Gendusha should be done with the Drava substance, with the liquid substance. If you are doing the gargling, that is called Gendusha. If you are doing with the Kalka, that is Kabala. Okay, like that he has mentioned. So we know that if the Kabala is, we will be holding the liquid full inside the mouth and it will not be movable. Okay, the if it is only half quantity of water you will be holding in the mouth, and it is, we can gargle it, that is Gendusha. If we can't move the liquid substance whatever you have taken in the mouth, that is Kabala. Okay, so that is the Gendusha and Kabala Dharana. Asanjare Mukhe Purvam Kabalam. Okay, Asanjare, which means we can't move the liquid substance, whatever the substance we have taken, we can't move it, that is Kabala. We can move the liquid substance, that is Gendusha. So, but according to Sharangadhara, he is telling with the liquid substance, if you are taking, that is Gendusha. If you are doing with the Kalka, that is called Kabala Dharana. Like that he has mentioned definition for Gendusha and Kabala. Then Lebana should be done in the direction of the hair follicles where it is growing. So accordingly you have to do the Lebana karma. Then for the Vrana Shofa he has mentioned 7 treatments. Okay, 7 treatments he has mentioned like Susruta. So like a Shofava Chigilsa, first of all we have to start it. Okay, Ado Vimlabanam Kuriyat, like that Sushruta has mentioned, the same treatment you have to follow. So Shofahara Chigilsa or Shofahara Lebana you have to start first of all. Okay, so that is the 7 Upakrama which is mentioned by Sharangadhara for Vrana Shofa. Okay, Shodahara Chigilsa we have to be done. Then after that rest of the treatments are same as that of Susruta Chigilsa. Then Abhyanga, Parishega, Pichu, Basti. These are togetherly called as Murda Taila, which means Shiro Abhyanga, Shiro Parishega, Shiro Pichu, Shiro Basti. These 4 togetherly called as Murda Taila, and this order you have to study: Abhyanga, Parishega, Pichu, Basti, because Uttara Balavan. So the least Bala is Abhyanga, and the more Bala you will be getting in the Shiro Basti. Okay, so Shiro Abhyanga, Shiro Parishega or Shiro Dhara. Then Shiro Pichu, Shiro Basti. So these are the 4 togetherly called as Murda Taila. We are doing it for the head region. So the more Bala you will be getting by doing the Shiro Basti. In Shiro Basti, we will be tying a leather bag around the head area. Okay, so the tying the leather bag, the height of the leather bag, it should be 12 angula. Okay, 12 angula, and Shirobasi always you should be done in the morning time without having food. Okay, before taking food in the morning time you have to do the Shirobasi. And Dharana Kala, we will be pouring the oil into the leather bag and we will be holding the oil for some time. So the Dharana Kala is 1000 Matra Kala. Okay, so holding period of Shirobasi is 1000 Matra Kala, or otherwise Vedanoba Shanti, till the pain is reducing, that much time you have to hold the Shirobasi. Okay, so Samyak Lakshana or Samyak time. Okay, so till how much time we have to hold the Shirobasti, that is 1000 Matra Kala, or till Vedanoba Shanti we have to hold the Shirobasti. And Shirobasti, how many times you have to do? Till 5 or 7 days you have to do, and we can give it at any season. Okay, sabhi riduon mein kiya ja sakta hai. For every season we can give this Shirobasti, and maximum we can give it for 7 days. So 5 or 7 days only we can give Shirobasti. Next, after Shirobasi, he has mentioned about Karnapurana. So Karnapurana, we will be holding the oil in the ear. Okay. So for Karna Roga, if you are doing Karnapurana, so how much time we have to hold it? 100 matra kala. For Kandagada Roga, for that if you are doing Karnapurana, 500 matra kala is the Dharana kala. For Shiro Roga, if you are using Karnapurana, we should hold the oil in the ear for 1000 matra kala. Okay, so Karna Purana Dharana Kala, based on the disorder he has mentioned. For Karna Roga, if you are doing 100 Matra Kala, for Kandagada Roga 500 Matra Kala, for Shiro Roga 1000 Matra Kala. Then in the Karna Purana, if you are using liquid substance, Rasa Adi Drava Padartha. So liquid substance if you are using, then you have to do Karna Purana in the morning time before food, you have to do it. Okay, then if you are using Taila, okay, if you are using Taila for Karna Purana, then you have to do it in the evening, sunset time, you have to do the Karna Purana. Then we have seen Rekta Mokshana. So with many instruments we can do Rekta Mokshana, Sringa, Jalauga, Tumbi, Prachana Karma and Siraveda. For in each thing, how much quantity of blood we have to remove it. For Sringa we have to take 10 angula. Okay, 10 angula we have to remove it. Jalauga, ek hath means one handful. Then Tumbi, 12 angula, 12 angula. In Prachana, ek angula, 1 angula we have to remove the blood. In Siraveda, usually Siraveda we will be doing, if the dosha is spreaded all over the body, then only we will be doing Siraveda. Then Sega Ashchodana Pindi Vidalaga Tarpana Putapaka Evam Anjana Bhedase Netra Kalpa Sat Manehe. So Netra Kriya Kalpa. According to Sharangadhara, Netra Kriya Kalpa is 7 in number. Okay, Sega, Ashchodana, Pindi, Bidalaga, Tarpana, Putapaga, Anjana. These are the 7 Netra Kriya Kalpa according to Sharangadhara. Then he has mentioned Dandavarti. Okay, Dandavarti. So Dandavarti we can give it for Netragada Roga also, and for the Shukra Roga also we can give Dandavarti. Then after that he has mentioned some of the classification of the disorder. So Jwara according to Sharangadhara, that is 25 types are there. Hika 5 types, Pravahika 4 types, Visujiga 3 types, Dandalasaga only 1, Bavasir 6, Krimi Roga 21, Kamala 1, Halimaga 1, Kasa Roga 5, Shosha is 6, Gandamala 1, Grandhi is 9, Nadi Vrana is 5, Chardi is 7, Trishna is 6, Daha 7, Bhuda Unmada 20, Anaha 2, Jadarakni Vigara 4, Alasaga 3, Visha 9, Vilambika 1, Charmakila 3, Pandu 5, Kumbhakamala 1, Rektapitta 3, Kshaya 5, Andhavriddhi 1, Gendalaji 1, Asti Bhakna 8 types, Bhagandara 8 types, Varabheda 6 types, Murcha 4 types, Unmada 6 types, Amavada 4, Gulma 8 types are there. Ashmari 4 types, Prameha 20, Medo Roga 1, Arbuda 6 types, Sadhyo Vrana 8, Visarpa 9, Nasa Roga 18, Shiraha Kapala Roga 9, Pumsatva Dosha 5, Yoni Kanda 4, Garbha Roga 8, Bala Roga 22, Kshudra Roga 60 in number he has mentioned. Then Soma Roga 1, Prameha Pitaka are 10 in number, Shodha 9, Vrana 15, Shuga Roga 24, Karna Pali Roga 7, Shiro Roga 10, Netra Roga 94 he has mentioned. Okay, 94. Pratara 4, Artava Dosha is 8, Stri Dosha 3, Balagraha 12, Atisara 7, Ajirna 3, then Nidra, Tandra, Sannyasi, Glani. These type of disorders are 1 each. Then Amla Pitta 3 in number. The three types of Amla Pitta is Vada, Kapha and Vada Kapha. There is no Pitta dosha. Okay, according to Sharangadhara, Amla Pitta it is of 3 types: Vadaja, Kaphaja and Vada Kaphaja. Okay, Vadaja Amla Pitta, Pittaja Amla Pitta, Kaphaja Amla Pitta, like the 3 classification mentioned by Kashyapa Acharya. Okay. Then Nanatmaja Roga. So in that Nanatmaja Roga, Rektaja Nanatmaja Roga has mentioned only by Sharangadhara, and he has mentioned 10 conditions are there that is related with the blood. Okay, we have studied Vadaja Nanatmaja Vyadis are 80 in number, Pittaja is 40, Kaphaja is 20. Like that Nanatmaja Vigara is there, but Rektaja Nanatmaja Vigara that is mentioned only by Sharangadhara, and he has told 10 conditions are there due to blood related disorders we will be getting in the body. Okay, the next thing is क्वाद निर्माण में पात्र का मुख खुला रहना चाहिए, अन्यथा वह क्वाद दुर्जर हो जाता है. Which means during the preparation of the kwada, kashaya we are preparing, no, we will be putting the water, some drugs, and we will be boiling, and we will be reducing it to 1/4. Okay, that is the normal ratio. While reducing the dosage, you should not close the lid. Okay, while preparing the kashaya, you should not close the lid. If you are closing the lid, what happens? The evaporated water which is coming from the kashaya, that will touch in the lid, and it will again go back to the kashaya, so it will become destroy. So that's why always, if you are preparing kashaya, always you have to open it and you have to reduce the kashaya. Okay, if you are closing it, it will become very bad. It is not good for the the medicine will not become good. You have to open the lid and you have to boil it and reduce it, then only that kashaya will become good for our body. Then mando abhifanda bhedah syat kaha hai, syadam kaha hai, which means according to sharangadhara, kalpanas, kalpanas are there, no, like this swarasa kalka srida shida fanda. Okay, 5 kalpanas are mentioned by sharangadhara. So in that, mantha is a upakalpana of fanda, that is mentioned by sharangadhara. Okay, upakalpana of fanda is mantha. But according to Charaka, mantha is a upakalpana of hima. Okay. According to Sharangadhara, 5 kalpanas are there: swarasa kalka srida shida fanda. Okay, so mantha is a upakalpana of fanda kalpana. But according to Charaka, mantha is a upakalpana of hima kalpana. Okay, shida kalpana. Okay, like that one differentiation is there in the upakalpanas. Okay, mantha is a upakalpana of fanda, that is according to Sharangadhara. Mantha is a upakalpana of hima kalpana, that is according to Charaka. Rest of all the upakalpanas are same according to Charaka and Sharangadhara. Then we have studied Sneha Paka, Mrudu Paka, Madhyama Paka, Khara Paka, like that 3 Pakas are there. And we know that Mrudu Paka, it is usually used for the Nasya preparation. Khara Paka, it is usually used for the Abhyanga. Then Madhyama Paka is there. So the Madhyama Paka, according to Sharangadhara, that we can use it for the all kind of treatments. Okay, so Madhyama Paka Sneha ka prayog sabhi karmo hedu bataya hai. For all kind of treatments, we can use Madhyama Paka of Sneha. Mrudu Paka usually we have to be given for the Nasya Karma, and Khara Paka usually it is given for the Abhyanga. For Madhyama Paka, we can use it for all kind of treatments. Then next one is an important thing, always they used to ask in the exam, one of the preparation they will be telling and in which condition this preparation we will be using. Okay, so the Shakotaka Kwada, it is given for Shlipada. Sudarshana Churna is indicated in Jwara, but Sudarshana Churna Anupana is always Sheetala Jara, that always you should remember. Cold water is the Anupana of Sudarshana Churna. Then Lekhu Gangadhara Churna, that is indicated in Adisara and Pravahika. Vriddha Gangadhara Churna, that is indicated in Adisara and Grahani. Then Ajamodadi Churna is indicated in Adisara. Kapitashtaga Churna is indicated in Galaroga. Dadimashtaga Churna is indicated in Rojana and Dhibana. Narayana Churna is indicated in Udara Roga and Dushta Roga Gunapaham, which means we can give it for the many disorders. This Narayana Churna depends upon the Anupana. We can use Narayana Churna for many other disorders. So mainly it is mentioned in the Udara Roga, but this Narayana Churna we can give it for many other disorders by changing the Anupana. Then Akara Karabhadi Churna, it is indicated for the Shukra Stambaga. Shriman Bahushala Guda, it is indicated for Bavasira. Vyoshadi Vadi, it is indicated in Pinasa. Surana Pind is indicated in Bavashira. Bavasira is Ashras Roga. Okay, Ashras. Then Pippali Modaga is indicated in Dadugada Jwara. Chandraprabhavati is indicated in Prameha. According to Rasendra Sara Sangraha, it is indicated in Ashras. Then Kankayana Vadi is indicated in Gulma Roga. Yogaraja Gugulu is indicated in Shodha, Vata Rekta and Udhara Roga. Kanjanara Gugulu is indicated in Apachi, Arbuda and Grindi. Kandagari Avaleha is indicated in Hikka, Shwasa and Kasa. Kushmand Avaleha is indicated in Rekta Pitta. Kudaja Avaleha is indicated in Adisara. Then Changeri Grida is indicated in Guda Brahmsha. Masura Grida is indicated in Adisara. Kamadeva Grida is indicated for Kama Shakti Vardhaga. Paniya Kalyana Kalyanaka Grida is indicated in Abasmara. Then Amrita Grida is indicated in Vadarakta, Mayura Grida is indicated in Shiroroga, Phala Grida is indicated in Maiduna Shakti Vardaka, Sandana Ulpadaka, Angaraga Thaila is indicated in Jwara, Narayana Thaila is indicated in Vada Vyadi, Kasisadi Thaila is indicated in Bhavasira in external. Okay, Bahya Prayoga, not for internally, externally we can apply Kasisadi Thaila. Then Pinda Thaila Vadarakta. Okay, that is also for external Prayoga. Okay, for the externally application we can use Pinda Thaila, not internally. Arka Thaila is indicated in Pama and Vicharchika. Marijadi Thaila is indicated in Kushta and Vicharchika. And Marijadi Thaila is prepared by using the Sarshapa Thaila. Then Nimba Bija Thaila is indicated in Palitya as Nasya Karma. Then Eshti Maduga Thaila is indicated in Keshashmasru Dridagara. For the strengthening of the hair we can give Eshti Madhu Thaila. Then Sanjeevani Vati we can give mixed with the Ardraga Swarasa. Then Ajirna, in Ajirna and Gulma we have to be given Sanjeevani Vati one dosage, morning and one vati in Ajirna, in Gulma also one vati dosage, Visujiga 2 vati, Sarpadamsha 3 vati, Sannipadaja condition 4 vati. Okay, like that we can give Sanjeevani vati. Then Karanja Thaila, it is indicated in Indralupta, Bilva Thaila is indicated in Badiriya, Vajri Thaila is indicated in Kushtaroga, Chandanadi Thaila is indicated in Kshaya and Rekta Pitta, Chakramarda Thaila is indicated in Gandamala, Kumari Asav is indicated in Udara Roga, Jwarangusha Rasa is indicated in Tridiya Gajwara, Sujiga Bharana is indicated in Murcha and Sannipada, Ichabhedi Rasa is indicated in Vishtamba and Afara. Swayam Agni Rasa, that is indicated in Kasa and Kshaya. Hinguadi Thaila is Karnashula. Grihaduma Thaila is indicated in Nasa Asha. Karaviradi Thaila is indicated in Roma Shadana. Vaja Thaila is indicated in Gandamala. Ushi Rasa is indicated in Rekta Pitta. Kudajarishta is indicated in Jwara. Shidari Rasa is indicated in Vishama Jwara. Naraja Rasa is indicated in Udavarta. Raja Mruganga Rasa is indicated in Raja Ekshma. Suryavarta Rasa is indicated in Shwasa Roga. Then Hamsa Potali Rasa is indicated in Grahani. Udaya Aditya Rasa is indicated in Shveda Kushta. Sarveshwara Rasa is indicated in Kushta Roga. Agni Tundi Vati is indicated in Agni Mandya. Vidangarishta is indicated in Vidradi, Ashmari and Prameha. Trivikrama Rasa in Ashmari. Mahataleshwara Rasa Kushta. Gaja Kesari Rasa Shula. Dashanga Leba Visarpa. Then Ananda Bhairava Rasa, that is indicated for Tridoshaja Adisara. Then Vasanta Kusumagara in Prameha. Then Trinetra Rasa in Pakti Shula, that means Parinama Shula. Ajirna Kandaga Rasa in Visujika along with the Kandagari Swarasa. The bhavan of Ajirna Kandaga Rasa is Kandagari Swarasa. Sringyadi Churna, that is indicated in Kasa and Vamana. Ingredients are Karkadaga Shringi, Pradivisha, Krishna and Madhu. Dadi Mashtaga Churna, it is in as Rojana we can give. So Achamodadi Churna, it is indicated in Amavada. Then Rasna Panjaga Kwada is indicated in Amavada. Then Falatrigadi Kwada is indicated in Prameha. Then Agni Tundi Vadi is indicated in Agni Mandya. So these medicines are very important medicines, and which condition these medicines are giving. So very important. So from this area one question always they used to asking from the Sharangadhara Samhita. Okay, so these are the main important points which is told by Sharangadhara. So this is also very important topic for studying for exams. Okay, so we have finished the Sharangadhara Samhita main important points.